This is Melissa. She's 8 years old and has a brother and a sister. She's a normal little girl, but she has to go to the hospital and receive surgery because Melissa's heart is sick. Melissa's quite well. She doesn't really feel that there's something wrong with her heart. Nevertheless, she needs a heart surgery very urgently. At the age of 7 months, Melissa already received a heart surgery. At that time, she had a narrow part of a blood vessel which impeded the circulation of her blood from her heart into her body. It was here exactly, this round bow. This one is called aorta. You can say that this is the most important blood highway, and it distributes blood from the heart to all parts of the body. In Melissa's case, this part was too narrow, as if you try to drink cornflakes with milk through a straw, which is very hard. Since surgery, she had to go to medical checkups regularly. That's very important. That way, the doctors detected Melissa's new cardiac problem. A few years ago, a little spot has been growing in Melissa's heart, which shouldn't be there. This part is exactly located underneath the aorta in the left ventricle. The doctors call it ulcer or stenosis. You can imagine a kind of knob in this area. Due to this knob, the blood in Melissa's body isn't able to flow correctly. It is very exhausting for her heart to make the blood flow into her aorta, because the knob narrows the route for Melissa's blood. Therefore, the doctors and nurses do everything they can to help Melissa. Here in the Children's Medical Unit for Heart Diseases, Melissa and her parents are expected already and are warmly welcomed. The nurse also makes initial examinations with Melissa. She's being weighted, measured, and her blood pressure is checked.
Okay. Luft. Kriegst du mir jetzt so ein Zauberpflaster, damit wenn du gepiekst wird, es nicht wehtut. Ja?
This is Melissa's room in the hospital ward. While her mom unpacks her clothes, Melissa takes a look at her new magic plasters. This cream reduces the pain caused by the injection when they take my blood. Melissa is checked thoroughly prior to the surgery. She is already aware of most of the examinations. She has often seen the doctor, also here in this hospital. These checkups are really very important, because Melissa must be in shape for the surgery. If she is having a cold, the date of the surgery may be rescheduled, because the cold would weaken her defensive forces, and this could be very dangerous for her surgery. On the screen of the ultrasound, we can see Melissa's heart very clearly. The doctors can see very precisely how her heart works and what needs to be considered during surgery. And there it is, Melissa's heart. The doctor shows Melissa and her parents which area has to be operated. In the afternoon, the surgery consultation takes place. All questions that come to Melissa's or her parents' minds can be asked, because the opposite of fear is information. After this, you can understand everything much better.
Hier unterhalb der Hauptschlagader, da findet sich hier so eine, ja, so wie so eine narbige Verdickung. Und diese narbige Verdickung führt dazu, dass diese linke Herzkammer sehr viel Kraft aufwenden muss, um das Blut in die Hauptschlagader zu befördern. Also das hängt so ein bisschen.
The surgeon explains exactly what's wrong with Melissa's heart and what will be done during the surgery. The doctor's the one who will carry out the surgery. And Melissa has already read the book Anna's Herz-OP. In this book, everything is explained in a way for children to understand what is going to happen with them. Now we're going to find out if the magic plasters did a good job. Melissa's waiting for her last examination, taking a blood sample. Fortunately, these magic plasters have numbed the skin of Melissa's hands. And another help is the moral support by mom and dad.
1, 2, 3. Pika, fertig. War schlimm? Na, siehst du.
Das ist echt tapfer super gewesen. Richtig gut. Okay. Nicht das Haar mit einkleben. So. Gut. Dann hast du das geschafft hier. Ja, noch.
Next morning, the time has finally come. Melissa receives her surgery. Therefore, she doesn't get any breakfast today, in order to keep Melissa's stomach empty. Otherwise, she may throw up during the surgery.
Okay, Melissa. Hast du ausgeschlafen? Das ist toll. Das ist toll. Wie ist das? Tabletten nimmt sie lieber ganz oder aufgelöst? Ich glaube lieber ein bisschen aufgelöst, ne? So.
Mit der ekligen.
Er schmeckt nicht gut, kann ich dir sagen. Aber machst du einfach mal einmal so und runterschlucken und dann ist es fertig. Dann steht, jawohl, genau. Gut, ne?
Dressed for the surgery and a little bit tired already, Melissa is brought to the surgery room while lying in her bed. Mom, Dad, and the nurse accompany her there. She gets a medicine by injection in order to calm her down. Mom and Dad must say bye-bye in front of the operating room, but the tiger is allowed to get there instead, so Melissa isn't all alone. In the room next to the operating room, Melissa is given an anesthesia, which makes it possible to have a painless sleep. This doctor also cares for initiating intravenous access. These tubes you can see here. With these tubes, Melissa gets her medicine as well as liquids directly and in the right doses. And just in case, she can even be administered with blood too. But she doesn't notice anything anymore. She's sleeping soundly. Now Melissa is finally brought to the operating room. But it still takes a while until the surgery starts. Everything must be prepared very well. Now the surgery is ready to start. For the surgery, the doctors need quite a lot of equipment displaying if everything runs well and Melissa is all right. For this reason, there are so many people working in the operating room. Everybody has a special function and pays attention precisely. Now the heart-lung machine starts to work for Melissa's heart. During the surgery, her heart is having a break, so the surgeons can do their work much better. Because the surgeons wouldn't see very good if her blood runs through Melissa's heart, as it usually does. But with the help of the heart-lung machine, they are able to see very good. You can't say exactly how long such a surgery takes. This is very individual and differs from child to child. Now everything is okay. The doctors check the ultrasound picture again and are very satisfied. The disruptive knob is gone. Here's the comparison. This part has been removed. Now Melissa's heart is able to work as normal as a healthy one and must not work so hard any longer. Now her heart works for the heart-lung machine again, and the surgeon may suture her thorax. Melissa gets a plaster in order to make it heal very well. Melissa is brought to the ICU, the intensive care unit, into another bed. Of course, accompanied by her cuddly toy tiger. In the ICU, she's receiving a very special care around the clock. Melissa's surgery was successful. She's very well and the doctors are happy. Due to the anesthesia, she will sleep some more. While Melissa is brought to the unit, the surgeon explains the result of the surgery to her parents and another two friends. There are a lot of medical devices, cables and tubes at Melissa's bed, so she can be supported with everything she needs. The monitor measures the heart rate, blood pressure and oxygen of Melissa. Another unit of equipment helps her breathing a little bit. And another unit automatically gives her medicine in order to keep her painless. Finally, she sees Mom and Dad again. Everybody's very happy that the surgery is over. In the afternoon, Melissa is going to wake up, and if everything is all right, she can move to a regular ward tomorrow. After a few weeks, Melissa is very much better. Everything turned out fine, but she still has to take pills to avoid rapid heartbeat. This is also called high heart rate. Melissa doesn't have to take these pills very much longer. She's very happy to be back home. Because she stayed in hospital nearly a week and a half after her surgery, she had a certain picture in her mind what the hospital would be like. But in the end, it was completely different. Well, I thought it might be a bit smaller. But it was very gigantic there. And they had games and other stuff there. The best thing was that my friends were there. But it was also very boring there. Everything is like it used to be, except her surgical incision. And finally, she can go riding again. Due to the surgery, Melissa's heart can work as normal as any other heart. However, she must go to the doctor regularly and learn to look out for herself and to be aware of the signals her body sends to her. She becomes an expert on her own behalf and soon will know very well what's best for her.